Good morning, and welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snetzeler, Editor-in-Chief of the journal. With me today, I have Dr. Julie Hess, who is a research nutritionist with the USDA Agricultural Research Service at the Grand Forks Human Nutrition Research Center in Grand Forks, North Dakota. We're focusing on her publication titled Vegetarian Diets During Pregnancy with Supplementation, Ovo-Vegetarian, Lacto-Vegetarian, Vegan, and Pescatarian Adaptations of USDA Food Patterns Can Be Nutritionally Adequate. Thank you so much and welcome, Julie.
Hi, thanks for having me.
So I'm going to begin with the first question, and it is, why is it important to look at dietary patterns in pregnancy?
So a lot of my work isn't actually focused on pregnancy. So it's kind of interesting that I got into this topic. But a lot of my work does focus on the dietary guidelines for Americans. And of course, with the 2020 dietary guidelines, for the first time, we had an investigation of the literature looking at dietary patterns during pregnancy and during lactation, which previously had not been part of the dietary guidelines process. So since my work focuses on the dietary guidelines and I saw this topic come up, I thought it would be something that I should gain some familiarity with, and then ended up seeing an opportunity for this study. So pregnancy, of course, is a hugely different life stage in terms of unique nutrient needs that accompany all the physical changes of pregnancy. And frankly, when I was going through some of the literature on it and reading also through the Dietary Guidelines Scientific Advisory Committee report, it seems that there hasn't been a whole lot of research on this population. And I think it's easy for us to understand why, given how vulnerable this population is, a relatively minor part of the population too, but because it is such an important life stage and life period, including for nutrition, I think it's one we need more research on. So I would say that it's important to look at dietary patterns in pregnancy because we need to know more about them and because we know that it's an important period for nutrition.
Such important details. Thank you. Then secondly, please explain your dietary patterns study design.
So this is where the dietary guidelines fits into both the focus of my research and then of this particular paper. So with the 2020 Dietary Guidelines for Americans, we had for the first time recommendations for an eating pattern during pregnancy and during lactation. And so the DGA has three dietary patterns: a healthy US style, a healthy vegetarian, and a healthy Mediterranean style eating pattern, and kind of indicates that any of these patterns could be appropriate during pregnancy and lactation as well. But with the vegetarian pattern, the one that's actually in the dietary guidelines is what's called a lacto-ovo-vegetarian pattern. So it includes both dairy foods and eggs. And I know vegetarians who don't consume dairy foods, who don't consume eggs, who maybe don't consume dairy foods or eggs. So in preparing for this study, my purpose was to see, well, if there are people who are choosing to consume a vegetarian diet, but not including dairy foods or eggs in their dietary pattern, how does that impact their nutrient intake? Is it possible to avoid either dairy foods or eggs during pregnancy and still meet nutrient needs? So that was really the backdrop and the impetus for doing this study. And so we ended up conducting a food pattern modeling study. So looking at the patterns in the dietary guidelines and then adapting those patterns, the vegetarian pattern, for an ovo-vegetarian diet, so a diet that includes eggs, but not dairy foods; for a lacto-vegetarian diet, a diet that includes dairy foods but not eggs; for a vegan dietary pattern that includes no animal products, we removed both dairy foods and eggs. And then we also looked at a pescatarian dietary pattern. So if you keep the eggs and dairy foods in, but you also add fish, how does that impact the nutrient adequacy of those patterns? And so we developed versions of this healthy vegetarian dietary pattern for all of those different variations on a vegetarian diet, and then looked at the nutrient adequacy. And we also looked at all of those patterns, both with and without the addition of kind of a average prenatal supplement, because we know that most people who are pregnant in the US do consume a prenatal supplement. We wanted to also see, well, how does that impact nutrient adequacy? Does that fill some of the gaps that you might see from eating these different dietary patterns? And so that was, in a nutshell, what our study looked at.
Very nice overview. I'm wondering then, drilling a little deeper, if you could review each of the dietary patterns that were focused on in your study, and then maybe indicate what supplementation is necessary for nutritional adequacy.
So I should say that we had an ovo-vegetarian pattern, a lacto-vegetarian pattern, a vegan pattern, and a pescatarian pattern, all adaptations on the original Dietary Guidelines for Americans Healthy Vegetarian Dietary Pattern. And so what we did to replace dairy in the patterns that don't have animal-based dairy foods is we actually took two of the foods that are in the dairy group, so fortified soy alternatives. So we combined fortified soy milk and fortified soy yogurt, and fortified with calcium, vitamin D, and vitamin A. And we use those to replace the parts of the dairy food group that are animal-based dairy food. So essentially, we created what we called a dairy alt, or a dairy alternative food group, and we basically removed all of the nutrients from dairy and replaced them with this fortified soy alternative to the dairy group. And then for eggs, we actually removed eggs in the patterns that didn't include them, and we added extra servings of the other protein groups that are in the Dietary Guidelines vegetarian pattern. So beans, peas, and lentils, nuts and seeds, and soy products. So if you removed 3 servings of eggs per week, then we would add 1 serving of beans, peas, and lentils, 1 serving of soy foods, and 1 serving of nuts and seeds to kind of make sure that the amount of food stayed about the same. And we saw that there actually weren't a lot of big changes in the nutrient profiles of the different dietary patterns. There were some little things that came up. So there were variations in the amount of iron that were provided by different patterns. There were variations in the vitamin D content. And some of these were made up for when we added the prenatal supplement in, and then some of them, like vitamin D, which is not necessarily in prenatal supplements, still was a nutrient of concern in those patterns.
Okay, thank you for that extra detail. What three things would you say a reader should take away from your research?
This is kind of a tricky question to answer because as a researcher looking at my own work, I can see all of the limitations to it and all of the things that we don't yet know, getting back to what I said before about the need for more research during pregnancy overall. But I would say from the study that we did, given its limitations, that we really need to take great care for nutrient adequacy, especially during pregnancy, because it is such a vulnerable life stage. And because, quite frankly, the nutrient needs are so different during pregnancy than during other life stages. I would also say from our research, it might be more challenging to follow a vegetarian diet during pregnancy, but our work shows that it is, at least in theory, doable. So some of the limitations with our work is we don't know if the bioavailability is the same with the different nutrients in a vegetarian diet versus a diet that contains more animal sourced foods. So there's definitely a need for more research too. So I would say the importance of nutrient adequacy during pregnancy, the need for more research about pregnancy and nutrition, so we can work towards better outcomes for parents and children. So when we started looking at some of the context for doing this study, it comes up right away that maternal mortality rates in the US are rising. And that's quite concerning from a public health standpoint. And so I think that just points to the fact that we need to understand more about what's happening during this life stage and what potential benefits adequate nutrition can offer to. And then third, I would say for folks reading this study who are practitioners or who may be consumers, that it's really important to talk with a healthcare provider who has knowledge about evidence-based nutrition science, maybe a not registered dietitian, when choosing a prenatal supplement, if that's at all possible. Because what we found is that looking at the dietary supplement database, there's a ton of variation in the prenatal supplements on the market, even just in terms of the nutrients that they offer, the amounts of the nutrients that they offer, there's huge variations. And so because different people are going to have different nutrient needs depending on their dietary patterns, depending on their life stage, depending on a whole host of other factors, it seems really important to consult with a healthcare provider knowledgeable about dietary patterns during pregnancy to make sure that any individual, any consumer, any patient is choosing a supplement that makes sense for them and supports their nutrient needs.
And then finally, how might those listening to this podcast use the research that you have done?
Oh, I think it depends on the role that listeners might have. For folks who are working in healthcare and providing dietary counseling to patients, I think this provides a path forward to considering a vegetarian diet for patients who might have a need for it, might have a desire to follow a vegetarian diet during pregnancy, that there is space and flexibility for that to be possible. And I think this study provides kind of guardrails for what to think about. We talk a lot about nutrients of concern during pregnancy. We talk a little bit about supplements, and we talk a lot about the different nutrients that are affected with different variations of vegetarian diet. So what happens when you follow an ovo-vegetarian diet? What are the potential nutrients of concern during pregnancy with that diet versus lacto-vegetarian versus vegan versus pescatarian? And what are the benefits to really consider for each person? What is it that you need to be prioritizing in your diet? And so I would say that's the takeaway that I would pull away, is that it is possible to consume any of these vegetarian variations during pregnancy when followed with care. And I think we provide some guardrails for that.
Wonderful. Thank you so much. Very nice summary. I so appreciate the details that you have provided related to your article. I think that what you've done with this research is novel, it's timely, certainly to Academy membership. And I thank you so much for responding to my questions and appreciate your time in participating in this podcast. Again, thank you.
Of course, thank you.